Hospitals can set in place training for health professionals and systems that help better monitor prescribing practices in this area.
Hospitals, I think, are as we say, often a very small window in someone's life, that they come in ill and they require an intervention at that point. One of the great things about these clinical care standards is they apply across the whole care setting, be that from the community, a residential care home, or a hospital, which actually allows a standard of care across all those settings, which is, after all, what's important to the person themselves.
I think thinking about transitions of care, so often people who need psychotropic medicines have very complex care needs, and it's really important that everyone's on the same page. So when we're writing a discharge summary, what's the purpose of the drug, how long is it on for, what dose changes do we expect to happen, what's going to happen next, are all things that the next clinician needs to know.
What we often hear from care staff, whether it be in aged care homes or, people living with disability, is that these medications are started in hospital. Often that's because there's been an acute situation where they need to sort of be looked after. But I think in hospitals is, don't just sort of leave it hanging. Have a plan, prompt, or make sure that in the discharge notes that you do mention the medication and do say that this was needed for this particular period of time, and emphasise the need for reviewing whether that medication is needed in the longer term.